Hello, everyone. Happy Thursday. Happy June. Welcome to the webinar today. We are super excited to have our colleagues and partners in the public health and harm reduction communities joining us today as we share more information about NASTAD's Racial Equity Collaborative for Drug User Health, a pilot program for people of color. We are going to go ahead and get started since it's just past the hour here. This program is hosted by NASTAD, and it is supported by our brilliant partners, Reframe Health and Justice and Healing Equity United. Next slide. So I'll just take a moment before we get into it and introduce myself and allow the other speakers today to introduce themselves. My name is Kirsten Forseth. I am a senior manager on NASTAD's drug user health team. I have been with NASTAD for just over a year and a half. I'm based in Baltimore, Maryland, and I've been working and volunteering in harm reduction for about the last 10 years. And I'll pass it to my colleague, Mark.
Hi, hope everybody is doing well. Thank you all for joining today. My name is Mark Lockwood, and I'm the Senior Associate on the Drug User Health Team here at NASTAD. I'm one of the newest folks at NASTAD on the Drug User Health Team. I've been here now for 5 months, and I'm currently based in Dallas, Texas, and I've been working in and volunteering in harm reduction now for the past 4 years. So nice to speak with everybody today. And now I'll pass it over to Justice.
Hi, everyone. I hope I'm calling in from sunny Seattle, which I never get to say, so that's really exciting. And I'm Justice. I go by she, they, or aya pronouns, and I am a partner with Reframe Health and Justice. I've worked at the intersection of public health and human rights for 12 years now, and many years before that was experiencing it as a former injection drug user. But currently, I am both a partner within Reframe, and then I also am a Open Society Soros Justice Fellow, writing 2 books on rights-based approaches to sex work, sex trafficking, drug use, and healing.
Thank you so much, Mark, and thank you, Justice. I'm really glad to have this group on the webinar today. And a few housekeeping points before we get started. This webinar is being recorded. The recording will be posted tomorrow, probably as soon as we can, after the webinar takes place. The slides will be available as well on NASTAD's Drug User Health website, and we'll send out a follow-up email to all those who are attending and who have registered for the webinar with a link to the recording. So you'll be able to view that or share that with colleagues. We ask that everyone mute their line, please, and to ask a question, you can use the Q&A box in the lower right-hand part of the GoToWebinar screen, and you can see audio information as well on the screen. We do have a staff member monitoring the Q&A box, so we'll be alerted to any questions sort of as we go through the presentation. We'll also be leaving plenty of space to hear your questions and comments at the end of this hour. Okay, and here's kind of a roadmap of where we are hoping to go during this time. First, we'll talk a little bit more about NASTAD for those of you who aren't familiar. Then we'll hear from Justice about Reframe and sort of their involvement in this effort, how they approach this work. We'll share details about the collaborative, the Racial Equity Collaborative for Drug User Health, the curriculum, the structure, sort of the goals of this program, and we'll share about the application process, the timeline, some key dates to be aware of, and then we'll open it up for questions. Cool. Okay, so we can move into the next slide. I think, but just looking at who registered, I think many of you are pretty familiar with NASTAD, although some of you might not be as familiar with our history and our work. So I'll kind of quickly review that. For those of you who aren't familiar, the acronym stands for the National Alliance of State and Territorial AIDS Directors. And it's kind of an outdated acronym, but we are a nonprofit national association formed in 1992, and we represent public health officials across the country who administer HIV and hepatitis programs. And at the time that NASTAD was founded, we really provided a much needed platform for advocacy and mobilization for public health agencies around the AIDS crisis. Since then, our work has really expanded to incorporate more robust hepatitis, drug user health, and health equity portfolios. NASTAD's mission is to end the intersecting epidemics of HIV, viral hepatitis, and related conditions. And we work to do that primarily through strengthening governmental public health, through advocacy and capacity building. So next slide. So I just shared NASTAD's mission and vision, although I want to note that we are currently undergoing a strategic planning process as an organization, and we're going to be updating our mission, vision, values, guiding principles, and strategic priorities. So I wanted to share a little bit about that with you today, although it's still in process, because I think it's important sort of background and context for how we're approaching this particular initiative. Although NASTAD has always approached our work with a social justice lens, as we go through this strategic planning process, we're really finding the need to kind of clarify what this means and what this looks like, including being really explicit about our role in advancing racial justice. So as an organization, this is what we believe. We believe every person has equal value and dignity. We believe access to quality healthcare is a basic human right. We believe that we have an obligation to dismantle systems that perpetuate social and racial injustice. And the harm reductionist in me is happy to hear kind of some echoes of harm reduction philosophy in these values. And let's move next into sort of what this looks like and what this means. So it's important that our values kind of carry through and drive our priorities. And here, this is again a draft version, but the 4 priorities that we're kind of looking at as we revise our strategic plan and mission and vision. So we can see that strengthening public health systems, of course, is one of our top priorities. Implementing integrated approaches across HIV, viral hepatitis, STIs, harm reduction, the social determinants of health. Advancing racial and health equity with a focus on stigma elimination and strengthening organizational excellence. So this gives you a sense, hopefully, of kind of where NASTAD is in terms of what our priorities are as an organization. And then we'll talk a little bit more about sort of what this looks in practice and how this initiative is hopefully sort of a moving into action from these values and priorities. Next slide. So one of the pillars of NASTAD's work in strengthening health systems has always been capacity building, and one of those elements is workforce development. And there are lots of ways in which NASTAD has supported our members to develop a diverse public health workforce that's reflective of the communities most impacted by HIV, viral hepatitis, and related conditions. And one of the big ways that we've done this is through the Minority Leadership Program. So since 2012, NASTAD has been involved with the Minority Leadership Program, investing in and increasing the capacity of emerging leaders of color. MLP has supported over 100 graduates through 8 cohorts, by providing a space rooted in social justice for staff of color to engage in critical conversations around job advancement and to visualize and own their leadership roles. We are really fortunate to have colleagues at NASTAD who have who've gone through MLP themselves and are now facilitators of the Minority Leadership Program, and to be able to learn from their experience. And this is where some of the inspiration came from for the Racial Equity Collaborative. We knew about how crucial MLP has been for folks, and that inspired us to think about, how might we adapt this program for people working in harm reduction and drug user health. Next slide. So drug user health kind of occupies a unique position, I think, within NASTAD and also within the fields of public health and harm reduction. And as we thought about what it might look like to invest in people of color doing this work, we thought about this landscape and how NASTAD is positioned to provide support. So through the CDC-funded National Harm Reduction Technical Assistance Center, we provide TA directly to syringe services programs in the community. And they may be sort of grassroots or independent or run by CBOs, or they may be led by health departments. Any agency that's operating a syringe services or harm reduction program, we provide direct support to. And then we also provide technical assistance for state public health agencies that support SSPs. So this means we're often in a position to translate community needs to public health officials, to support CBOs, to engage with their state or local health departments, to assist in developing effective relationships across sectors, and to advocate for the investment of resources where they are most needed. So as we envisioned this program, we felt strongly that it needed to encompass people working in different contexts and in different positions in and outside of governmental public health, because this is where a lot of the innovation and on-the-ground work has happened historically, and is still happening. And we know that communities of color have been practicing harm reduction long before it became institutionalized public health practice, right? And we also believe that there are many ways to make change, whether it's working within government, outside of, or in partnership with public health systems. Next slide, please. Okay. Oh yeah, I remember what I did. Okay. So yeah, so just to kind of wrap all of this up, I think also we are in a particular moment right now where we see that there is an increased willingness among leaders, especially white-led organizations, to recognize racism in public health, to talk about racism in health and racial equity, and to make it a priority. Many of you will have seen that CDC recently declared racism as a public health crisis. The new administration is making efforts to integrate health equity and racial equity into all areas of their agenda, including their first-year drug policy priorities, which we were also excited to see harm reduction mentioned there too. And if you press one more time, there's one more. Yeah, so we also see the first ever sort of explicit federal funding for harm reduction services, which was in the COVID Relief American Rescue Plan Act that passed recently. So just kind of given all of these circumstances, I think that there's an opportunity to take advantage of this increased funding for and investment in harm reduction at the federal level, to make sure that racial equity and justice remain central priorities, and to support leaders of color to be in the positions of power and decision-making around these resources. We know that structural and systemic racism often keep Black and brown people from accessing leadership positions. So we can't assume that sort of a cohort or collaborative program like this will help fix that gap. But we hope to use this program to develop a mutual support network, introduce people to mentors, and grow the collective strength and power of Black, Indigenous, and other people of color. So this was a kind of a long-winded introduction, background, context. This is how we're thinking about the collaborative, how we're approaching this work, how it fits in with the larger sort of NASTAD. approach. And I will pass it on now to Justice to talk a bit about Reframe and how they're approaching this initiative.
Thank you so much, Kirsten. And I'll ask you to go ahead and go to the next slide. I'm going to introduce the consulting collective I'm with, Reframe Health and Justice. So next slide, please. Awesome. So I really love that this program centers the idea of safe space. And I think that in drug user health, we know this intimately, right? We're looking for safe injection spaces. We're looking for psychedelic treatment programs that are really intentional. And we're also looking for a safe space to understand and transform public health systems when we know that racism is a public health crisis. And so I really think that's amazing, because Reframe itself was formed to give queer consultants of color who work at the intersection of human rights and public health a safe space to try to create a safer world. And so we are queer consultants of color who have backgrounds in drug user and sex worker health, who work to develop and deliver holistic harm reduction solutions to social injustices. And that work ends up being all over the board, from strategic planning to capacity building to advocacy and culture shifting work. And so this program is actually right at the intersection of all of our expertise. And a lot of the areas that ends up being in are racial and gender liberation work, ending mass incarceration, and HIV and hepatitis C prevention. Next slide, please. Our approach to this work is one that can really be found in data. We see that there are less people of color who are working in harm reduction, and also that there's less people of color who are able to access treatment or any sort of services. And we know that this is structural racism, and that this underpins the war on drugs and all health disparities. And that without intentionality, our systems are just going to perpetuate structural racism. But it's more than just representation. And so it's really important to develop a workforce of color to be able to address structural racism, to be able to start to transform some of these conditions. But it really requires a space crafted through the lens of centering BIPOC experiences and leadership, and then also a safe container with which we're using anti-oppression, harm reduction, and healing justice philosophies. And this is where our partnership with Healing Equity United is really exciting. They are also a collective of consultants of color who work to address and transform racialized trauma, and they all come from anti-violence spaces. And so it's really exciting to also be able to have this intersectional lens through which we address this cohort and be able to develop skills and address those things. And so I'm excited to talk a little bit more about how we start to integrate that in a bit. So I think at this point I turn it back over. Oh, no, I don't. It's still me. Okay, sorry. How we designed this was really intentional. So along with NASTAD, Healing Equity United, and then Reframe Health and Justice, we held a consultation process to be informed about what the design of this cohort should look like, and the shape in which it should take. And so we talked with the Minority Leadership Program at NASTAD. We talked with Healing Equity United, and then we ran 2 focus groups in which we gave stipends to participants to attend. And the people who attended ended up being a lot of BIPOC who've worked in the field for a while, and folks who work in the field who are supervising BIPOC and have a lot of understanding about what people need and what sort of structural changes could be helpful. And from there, we asked folks what they would like to see. And so we did 1 focus group with health department representatives, and then 1 focus group with representatives in the harm reduction field who work at community-based organizations, nonprofits, etc. And the information from this was then ciphered to lead to the integration of healing justice components to sessions and programs. And so there's going to be a big focus on navigating racialized trauma, on transforming that, and having very intentional openings and closings to the space that we're going to be creating together. And then also some really important topics that folks want want to dive into. So there's going to be a focus on organizational structures, funding, coalition building, as also power mapping. And along with the mentorship component of this, there's a desire to have a low barrier deliverable. So there's a grant component to this that is going to be very low barrier so that people can work on the transformation that they would like to see. And that has very few stipulations. So that can really be generative and come from the time that we spend together in the sessions and in the cohort process. Next slide, please.
This is where I come in. So I want to thank both Kirsten and Justice for sort of laying out the scale and scope of how we come into the collaborative. So now I'll be discussing one, sort of the nuts and bolts of the collaborative, as well as the application process itself. I want to say with full transparency that as someone that is still new within harm reduction, that I'm really excited that this program is being kicked off. About the collaborative, so the Racial Equity Collaborative for Drug User Health is a pilot program that is really intended to create a supportive space for a cross-career stage and cross-sector group of up to 12 BIPOC that are navigating the landscape of governmental, public health, nonprofit, policy and research, as well as philanthropic fields that support the health of people who use drugs. Now, full disclosure as it pertains to the term BIPOC. We understand in both social justice spaces that the term BIPOC was developed to prioritize Black and Indigenous people when responding to the harms that people who are targeted by structural racism face. I also recognize that the term BIPOC is imperfect in both its description and in its politics. However, we're encouraging all people from communities who are targeted by structural racism to apply to this cohort. Next slide, please. Now, to talk about some of the program components, the program consists of three primary components. Each program component is intended to develop connections between BIPOC who work in drug user health, as well as to support building their capacity to advance racial justice through a collaborative cross-sector change. The first component being, it's a 10-week virtual session, and they're weekly. So each weekly session will be facilitated with the intention of supporting the development of a mutually supportive, learning and connection-focused space. Each session will also be facilitated by BIPOC racial equity practitioners. The second component of the collaborative is the mentorship program, in which each participant will be paired with a mentor currently that works within the field of harm reduction. Participants will be paired with either a peer mentor or someone of more experience, according to the participant's preference. Each participant is expected to meet with their mentor at least 3 times during the duration of the program. And then the last component is the funds for an individual project. And this is to support the development of a racial equity focused harm reduction resource for BIPOC practitioners within drug user health. So the resource development or the project fund can take shape in many forms. It can be a safety and wellness plan for navigating racial justice in the public health space. It can be a professional development plan to support their career in advancing racial justice and harm reduction, or even a mini landscape evaluation of racial justice needs within your respective jurisdiction or harm reduction communities. Next slide, please. So the curriculum, as I mentioned earlier in the previous slide, it's weekly and will take place on Zoom. It'll take place every Tuesday between the hours of 4 and 6 Eastern time. And it's, as I mentioned before, the dates are July 13th through September 14th. Again, each participant will meet with their mentor at least three times during the duration of the program. And as an added bonus, we'll also be hosting weekly office hours on Wednesdays from the hours of 4 to 6 Eastern Time. And this office space or office hour will be a chance for participants to get general support, peer networking, as well as project planning. Next slide, please. So some of the curriculum that will be talked about during the collaborative are centered around organizational structures, coalition building, as well as funding and sustainability. Each session will also be facilitated by Reframe Health and Justice, Healing Equity United, as well as other experts or consultants within government, public health, community-based organizations, as well as policy and research. Thank you. Next slide, please. So now we're going to go into the nuts and bolts of the application process. Next slide. So who should apply? I think is, a large question. So we're encouraging all people from communities that are targeted by structural racism to apply. This space is intended for all people who've experienced racialized oppression, as well as Indigenous people who do not necessarily identify as a person of color. Applicants who have a deep lived and relational experience in communities they serve will also be prioritized. We're also looking for folks that have previous or current work experience within harm reduction and/or drug user health, as well as a strong understanding of and interest in advancing racial equity and justice within harm reduction. This can include folks working within government public health, but also can include folks working in nonprofit sectors, grassroots, independent sectors, as well as public health research and other philanthropic fields that continue to support folks who use drugs. Our true intention is really to bring forth a diverse group of practitioners from different backgrounds, different skill sets, as well as different career levels. So we anticipate that this cohort will be a mix of folks from various sectors, various racial and gender identities, as well as geographic locations. Next slide, please. So cohort expectations, as indicated here. So we expect participants to make their best effort to attend all cohort sessions, as well as to be engaged and active in the cohort sessions and mentorship sessions. We also expect that cohort participants will use the project funds to support racial justice within drug user health. And then lastly, we expect the cohort to communicate your feedback if you feel comfortable, largely to the drug user health team and/or Reframe Health and Justice. Next slide. So the application. So the application consists of, basic information such as your name, your email, as well as your location, as well as, the organization that you're a part of, your availability to attend all sessions, as well as other demographic information, your work/volunteer experience, as well as your lived experience. So I want to note that as it pertains to your organizational support, you don't have to represent an organization in order to apply to this program. If it's just you, write yourself in the application. We don't require that individuals have the support of their organization in order to participate, although it is encouraged. And I want to note that as well. As it pertains to lived experience, we're really interested in lived experience of folks that may use drugs or substances, folks that have had interactions with the criminal legal system, as well as folks that have been targeted for working or participating in underground or informal economies. There'll also be questions centered around what are some structural advantages that being, let's say, a public health degree, or disadvantages that being, let's say, for example, barriers to employment that have either advanced your career in drug user health or have created barriers for you within drug user health as well. Next slide. And then the next component of the application is centered around talking about some of the work that you do to support people who use drugs. How do you incorporate racial equity and justice within your scope of work? what do you hope to gain from participating in this cohort? What do you hope to contribute, as well as what do you look for in a mentor? So these, as it pertains to mentorship, it can include if you prefer to have someone that has the same racial or gender identity, what kind of drug user health or harm reduction experience you would like to have, or any other related information as well. Next slide, please. And then the last component of the application is talking about the small project fund, which is for individuals to support the development of a racial equity focused harm reduction resource for the cohort member. As I mentioned before, this resource can take shape in a variety of forms. And in the application, we're really interested in hearing how you plan to use the grant money. I want to be clear that your answer is not binding or will affect your cohort acceptance as well. And that pretty much takes up how we look at the application, what the application consists of, as well as sort of the nuts and bolts of how we've come into the collaborative. Thank you all so much. I'll kick it back to Justice.
Thank you so much, Mark. Next slide, please. I'm excited to talk about the selection process a little bit, the upcoming selection process. But first, let me tell you a little bit about timelines. So just some things that are upcoming. We are actually opening the application today. We'll be dropping the application link at the end of this webinar, and then it's going to be open all the way through June 21st. And so you'll have a period to promote this, pass it to other people to apply, and applicants can expect to hear back from us by June 30th, the end of the day on June 30th, and then that gives everyone a couple weeks before we start our sessions on Tuesday, July 13th, which will then run for 10 weeks through September 14th. So that's some of the timeline components. And then what's going to be happening while you all are applying is I'd like to tell you a bit about our selection process. So next slide, please. So, so this is more about what you can expect to gain from participating, because we are really looking for folks who can both give and take, right? We want this to be a mutually supportive relationship. And so this is a space to connect with other BIPOC and a space to be co-conspirators and to create cross-sector change. And that's one of the big things that came out of the focus group, is that folks want a networking space and a space to build together and a space to grow together during this cohort and then afterwards. And so that's one of the primary things that people will be gaining. Also a relationship with a mentor and a lot of resources to advance racial equity, including financial resources. And then also we're really grateful for NASTAD support and advocacy, which is going to be something that's ongoing. And all of this is really pilot, so there's just such a huge opportunity to create some shape for this and see how this looks. So next slide, please. The selection process. I hope you all were waiting because I've built it up by now. So we're going to be doing this here in a couple weeks. And so this is why I really want to encourage people when you're applying just to kind of bring yourself and be honest, because there's no kind of like version that you have to sell for us to pick you. Like, we want to pick you because you're you, because a lot of what we're going to be weighing is not just you, but a cohort as a whole. And so we're looking for difference, we're looking for diversity, and a diverse cohort is going to be determined through a matrix. And so all of the demographic data that Mark was talking about earlier is going to be input into a matrix, and we'll have some just like hard quantitative data that we can distill to try to create a very diverse but still complementary cohort. And then excellence refers to an individual's qualifications. So this is going to be determined through a scale of 5 grading points across 4 different categories. And so 1 through 5, looking at a participant's interest, a potential participant's perspective, and the value given, and then what they could take away from this. And so just so folks can already be kind of percolating on that. Next slide, please. And so with that, I am really excited to open up for question and answer. This was really just a quick run through of everything, and we wanted to leave a good amount of time for you all to ask questions or clarifications. And there's an opportunity to do that through email as well.
Yeah, thanks, Justice. Thank you, Mark. We are excited. Speaking for myself, I'm also nervous. This is definitely a pilot. We are just so grateful for folks in the community who've been doing this work to give us lots of feedback about what might be helpful, and then hopefully people will trust us enough to continue giving feedback as they go through this program about what's useful, what isn't, what continued support can NASTAD provide ourselves or through partnerships with other organizations. I don't know whether there are any questions in the Q&A or in the chat box yet. I don't see any. I'm not sure if people are allowed to unmute themselves, but we don't have that many people. So I feel happy if you want to raise your hand or go ahead and unmute yourself and ask a question out loud if anyone has one. Well, as people are thinking, I am going to go ahead and drop the link to the application in the chat. Yay, applications are officially open. I put the link in the chat. Feel free to go ahead and check it out or pass it on to colleagues or others in your network. This link will also be sent out, as I mentioned, in a follow-up email tomorrow, along with a link to the recording of this webinar and the slides, in case you want to share those with anyone else as well.
I should mention just a couple other things. It's a Google form. It really shouldn't take you more than 30 minutes. And then if there are any issues with the form, reach out. And also if people kind of are like different types of test takers in any way, like if this form is not something that is strength-based and want to have a conversation instead, please reach out and we could schedule something like that too. We really want this to be as accessible as possible.
I do see a question in the chat, and it says how many pages are allowed. So this is in reference to the application. And I think if I recall correctly, for the short answer questions, I think there's a 1,500 word or character limit, but we're not sort of selecting or scoring based on that. We are encouraging people to provide long or short answers. Justice, do you want to add anything to that?
Oh, just that I hate word limits. I'm not pithy, so I'm sorry, y'all. If anyone really has a lot more to say, though, just email works too. But hopefully, I mean, it was designed to not take that long. We don't want to take too much of your time.
And I did just see one question that said someone didn't receive the application link. So I have tried to also put that as an answer in the Q&A box, in the question box, but also feel free to reach out by email to any of us afterwards. Our emails are on this slide if you still don't see the application link, and we can send it right over to you.
And there is an additional question about what if someone doesn't want to apply on behalf of an organization, but would rather apply as an individual? Are your suggestions?
That's totally fine. The one thing I'll say is that it is I'm Pacific Standard Time, so this would fall in the middle of the workday, and so if there's a conflict with the organization you're with, y'all will have to work that out if you are like trying to do this while you're on the clock. So there might be some complications there, but if you want to apply as an individual and not as part of your organization, that's totally fine. We want to hear about your experience, but we also understand that there's many reasons you might want to do that. So it's totally fine.
Hi, everyone. This is Lily with NASTAD. I just got a offline question asking if it would be possible to see the application questions on a PDF or ahead of time in some other way, because a Google form can't be saved. And I haven't checked the FAQ. Is that in there, or is that something that you guys would be willing to provide?
Yeah, absolutely. So again, I think the best way to do this would be to email one of us, and we can provide you with the set of application questions so you can kind of see it all laid out in front of you. I agree, that's often a helpful thing for me too. And I don't think that's in the FAQ document, but thanks for mentioning that, Lily, because we can add it. And it also prompts me to say that we're creating a little kind of one-pager frequently asked questions document that will also be hosted on our Drug User Health website, along with this webinar recording and the slides and the application link. So that will be available shortly. And there's a question about emailing these slides. So we won't email the actual slides, but we will send a link to our webpage where the slides will live, so you can access them on our webpage. There's another question about, is this program incentivized? And I am not sure exactly what you mean by that, but I will answer this by saying we are offering compensation for mentors. So the people who serve as mentors will be compensated for their time. And we are also offering individual project funds to participants of this program. So folks aren't sort of like being paid to participate in the program, but they will receive financial resources to go towards a project. And we are trying to keep requirements around that really flexible and low barrier. And I hope that answers your question, Monica, but feel free to elaborate if I haven't answered it. Okay, well, I will sort of maybe talk for 30 seconds just to allow one final call for any questions. There is a question specifically about allowable use of funds. I think that's one that would probably be better to follow up with by email. If you want to put your email in, Hannah, we would love to follow up with you. Thank you for that question. And we're really excited to kind of put this out in the world and see who's interested, who applies, what kind of space can be created through this investment, and hear from you all about about whether that works and how we should be looking to continue this investment and commitment in the future. Any final words from my co-panelists?
Thank you all. I really look forward to applications and to piloting this cohort.
Yeah, and also just to echo what both Justin and Kirsten said, I'm really excited to see this program come to life. and really excited about the application process and hope that you all apply. Take care, y'all.
Okay, thank you everyone so much for your time. Thanks, Mark. Thanks, Justice. Take care. We will see you all in our email inboxes, hopefully. Bye, everyone.
Bye, everybody. Take care.